Facial muscles, also known as mimetic muscles. These are group of muscles located beneath the skin of face and scalp. They are unique in that they primarily insert into the skin rather than bones, allowing them to control facial expression by moving the skin. All facial muscles are supplied by facial nerves and vascularized by facial artery. Major groups and key muscles of the face. Muscles of the scalp, muscles of the auricle, muscles of the eyelid or orbital opening, muscles of the nose, muscles around the mouth, muscles of the neck. Now first is muscles of the scalp. Occipitofrontalis muscle. This is the muscles of the scalp, and in this picture we can see the occipitofrontalis muscle. Now second group of muscles is muscles of the auricle. These are the muscles situated around the ear. These are auricularis anterior, auricularis superior and auricularis posterior. In this picture we can see the all three muscles, auricularis anterior, superior and posterior. Anterior auricularis muscles pulls the ear forward. Superior auricularis muscles elevate the ear. The posterior auricularis muscles pulls the ear backward. Third is muscles of the eyelid or orbital opening. These are orbicularis oculi, corrugator supercilii, and third is levator palpebris superioris. In this picture we can see orbicularis and corrugator supercilii muscles, and in second picture we can see levator palpebris superioris muscles. Levator palpebris superioris is an extraocular muscle supplied by sympathetic fiber and the third cranial nerve. Now fourth is muscles of the nose. These are procerus muscle, compressor nares muscle, dilator nares and depressor septi. In this picture we can see procerus muscle and depressor septi nasi. In this second picture we can see dilator nares anterior and compressor narium minor. Now we will see the muscles present around the mouth. These muscles are orbicularis oris, buccinator muscle, levator labii superioris aleci nasi, zygomaticus major, levator labii superioris, levator anguli oris, zygomaticus minor, depressor anguli oris, depressor labii inferioris, mantalis and risorius muscle. This is the facial muscle, and in this picture we can see orbicularis oris, levator labii superioris aleci nasi, risorius muscle, mantalis muscle, depressor labii inferioris, depressor anguli oris, zygomaticus major and zygomaticus minor. This is levator anguli oris muscle and this is buccinator muscle. These are muscles present around the mouth. Platysma muscle. This is the muscles of the neck. In this picture we can see upper extension of platysma muscle and lower extension of platysma muscle. Now we will see the facial muscles with their origin, insertion, action and nerve supply. First is occipitofrontalis muscle, frontal belly, originated from epicranial aponeurosis and inserted into skin of forehead and eyebrows. It involving surprised expression of face, raises eyebrows, wrinkle forehead skin and protracts scalp. Occipitofrontalis muscle supplied by temporal branch of facial nerve. Occipitofrontalis muscle, occipital belly, originated from lateral 2/3 of superior nuchal line of occipital bone and inserted into epicranial aponeurosis. It retracts scalp, assists frontal belly and supplied by posterior auricular branch of facial nerve. Now orbicularis oculi muscle, originated from medial orbital margin, medial palpebral ligament and lacrimal bone and inserted into skin around the orbit, superior and inferior tarsal plates. Orbicularis oculi muscle closes eyelids. Its palpebral part closes eyelids gently and orbital part closes eyelids tightly. Orbicularis oculi muscle supplied by temporal and zygomatic branch of facial nerve. Corrugator superciliary muscle originated from medial end of superciliary arch and inserted into skin superior to the middle of the supraorbital margin. Corrugator superciliary draws eyebrows inferomedially, creating vertical wrinkles, and supplied by temporal branch of facial nerve. Now nasalis muscle, transverse part, originated from maxilla lateral to nose and inserted into aponeurosis across dorsum of nose. Nasalis muscle compresses nasal aperture and supplied by buccal branch of facial nerve. Nasalis alar part, originated from maxilla over lateral incisor and inserted into alar cartilage of nose. Nasalis alar part dilates nasal aperture and supplied by buccal branch of facial nerve. Procerus muscle. Procerus muscle arises from fossa over nasal bone and lateral nasal cartilage and inserted into skin of inferior forehead between eyebrows. Procerus muscle depresses medial end of eyebrows, wrinkles skin over dorsum of nose, and supplied by buccal branch of facial nerve. Depressor septi nasi originated from maxilla above medial incisor and inserted into nasal septum. Depressor septi nasi pulls nasal septum downwards to widen nostrils and supplied by buccal branch of facial nerve. Mentalis muscle. Mentalis muscle originated from incisive fossa of mandible and inserted into skin of chin. It elevates and protrudes lower lip, wrinkles, skin of chin. Mentalis muscle supplied by mandibular branch of facial nerve. Depressor labii inferioris muscle originated from anterolateral body of mandible and inserted into skin of lower lip. It depresses and everts lower lip and supplied by marginal mandibular branch of facial nerve. Depressor anguli oris muscle originated from anterolateral base of mandible and inserted into modiolus at angle of mouth. Depressor anguli oris muscle depresses angle of mouth and supplied by marginal mandibular branch of facial nerve. Levator anguli oris muscle originated from canine fossa of maxilla and inserted into modiolus at angle of mouth. It elevates angle of mouth medially and involving smiling expression of face, supplied by buccal branch of facial nerve. Zygomaticus major muscle originated from lateral spect of zygomatic bone and inserted into modiolus at angle of mouth. Zygomaticus major muscle elevates angle of mouth and also involved in smiling and supplied by zygomatic and buccal branch of facial nerve. Zygomaticus minor muscle originated from lateral surface of zygomatic bone and inserted into skin of upper lip. It elevates upper lip and also involving smiling expression and supplied by buccal branch of facial nerve. Risorius muscle originated from fossa over parotid gland on the masseter muscle and inserted into skin at angle of mouth. Risorius muscle draws angle of mouth laterally and supplied by buccal branch of facial nerve. Now buccinator muscle originated from alveolar process of maxilla and mandible and pterygomandibular raphe and inserted into mediolus and blends with orbicularis oris muscle. Buccinator muscle compresses cheek against teeth, assists in chewing and blowing, supplied by buccal branch of facial nerve. Levator labii superioris muscle originated from infraorbital margin of maxilla and inserted into skin of upper lip. It elevates upper lips, deepens nasolabial sulcus and supplied by buccal branch of facial nerve. Orbicularis oris muscle originated from medial maxilla and mandible and angle of mouth and inserted into mucous membrane of lips. It closes oral fissure, compresses and protrudes lips, supplied by buccal branch of facial nerve. Now platysma muscle, this is the muscles of neck, originated from fossa covering the upper part of pectoralis major and deltoid muscles and inserted into lower border of mandible, skin of lower face and the angle of mouth. It tenses the skin of the neck as in expression of fear or stress It depresses the mandible slightly, helps open the mouth, and draws down the lower lip and angle of mouth as in expression of sadness or fright, and supplied by cervical branch of facial nerve